Hey everybody, it's Dr. Whitaker. Welcome to day 3 of your Dr. Wordle, Doctordle. I'm going to try and do these daily. I got some feedback to use a little bit less jargon, so I'm going to try and explain things and explain kind of how I go through my process. So, question for today, what's the diagnosis? A 30-year-old man presents with several weeks of profuse watery diarrhea. So, okay, the things that are important to look through with these types of questions are, what's the patient's age? So 30 is not a kid, but still relatively young. Gender oftentimes can be relevant, so man. And then the time frame is important. Is it a day? Is it a week? Is it months? Is it years? So several weeks and profuse watery diarrhea. So they're classifying this. They're saying this poor guy is having a ton of diarrhea. And they're saying watery on purpose to clarify, because there's different types of diarrhea. There's inflammatory, there's secretory, and the way they're described will have different explanations for why it is. And it's several weeks. It's not a day or two. So just looking at this right away, younger guy, profuse watery diarrhea, I'm thinking it's probably either secretory, meaning not inflammatory, is more of, involving like blood or pus, or inflammatory, I think more of like inflammatory bowel disease, or any type of, really severe infectious type. If it's several weeks of watery diarrhea, that makes you think more of secretory. And so secretory oftentimes can be infectious like a virus, but it also can be due to different hormone levels in the body that are causing issues. So the first thing I'm gonna guess is celiac disease can cause profuse watery diarrhea. No. Reports. Okay, so now the patient's reporting fatigue, decreased oral intake without fever or abdominal pain, and has lost 20 pounds over the past 2 months. So weight loss is going to make you think in this case. Again, it could be infectious, but oftentimes weight loss can be nutritional. So that's why I was thinking celiac disease. Over the past 2 months, it also makes you think of things. Generally, if you see weight loss, you can think of certain infections like HIV. You also can think of cancer a lot of times. So hopefully it's not what this patient has. There's also no fever. Fever makes you think of malignancy or infection, abdominal pain similarly. So it seems like this patient, relatively speaking, is having fatigue, weight loss, and diarrhea. So I'm gonna guess, again, I think this is nutritional. They're 30. Sometimes in your 30s, you can start thinking about people developing autoimmune diseases, but I'm still thinking this is nutritional. So what are they not absorbing that's causing diarrhea? Again, I would have thought celiac disease. I'm gonna say, now leaning more towards infection, I'm gonna say HIV. Physical exam reveals dry mucous membranes and blood pressure decreasing from 125/84 to 101/72 while standing. So what they're saying is this person's very, very, very dehydrated, and to the point where what they're measuring, those are called orthostatic vital signs, meaning that when you stand up, all the blood goes to your feet because you're dehydrated, and it can cause people to faint and be dizzy. So again, it's not really telling us much more other than this guy's really dehydrated. Yeah, I'm not gonna lie, I'm having trouble figuring out what would be the causes of this. There's one that I can't remember what it's called, of course, but it's something I rarely, if ever, have seen, but it's... I'm trying to remember what it's called. But it's like, there's a tumor that causes, I can't think what it's called, but it